Hi everybody. Welcome to our next session of the 2021 Virtual Vanderbilt Summer Science Academy. As you know, Wednesdays are MD days. So today we're hearing about the journey from more advanced graduate students. We've got two. Our first one up is Hannah Kay. And she's going to tell you a little bit about her journey, her path to the MD. And a little bit about our background. Thank you so much, Hannah, for being here. I'm excited to hear your talk.
Awesome. Thank you so much for having me. I'm going to share my screen, which I know can get a little dicey. So let me make sure that works. Okay.
Looking good so far.
So you can see that, but I do want to put it in presentation. I move this bar. Okay, here we go. Oh no. Sorry.
Oh, you're fine.
It gets a little dicey.
Technology.
Okay, can everyone see that?
Perfect.
The look in full screen and such?
Yep.
Great. So hi, my name is Hannah again. I just started my 4th year of medical school. I'm actually in the middle of my ENT sub-internship rotation, which has been awesome, but I'm really happy to be here. Thanks for having me. I titled my presentation Enjoying the Journey, because that's what I feel like I've been privileged to do, and I would encourage all of you to do that too if you're thinking about pursuing medicine. So let's try to advance this. So let's start at the very beginning. I'm just going to tell you a little bit about myself. I am from Lincolnshire, Illinois. It's about an hour north of Chicago, pretty standard suburb. And the people that are in this photo here are me at the bottom, and 3 people that I think really influenced my decision to become a doctor the most. I also have a mom. She's not in this picture, but she's also great. In the middle is my dad. So my dad is a private practice psychiatrist. So growing up with a physician as a father obviously influenced me a lot there. I was always kind of in awe of his very encyclopedic mind, but at the same time, his ability to understand people. And on the left is my older brother, Harrison. He was kind of like classic oldest child, very high achieving, sort of set the pace for the rest of us, straight A student, that kind of thing. He, helped me to pick classes and taught me how to play volleyball and video games and music and all of that stuff. And he ended up going to Stanford for undergrad and then Vanderbilt for medical school. And he is now at USC finishing his orthopedic surgery residency. And I have always just looked up to him. And I think just wanted to be like him my whole life. So I think that also had a big influence on me wanting to be a doctor. And then the person on the right is my second oldest brother, Hamilton. And he was actually diagnosed with neuroblastoma when he was 2 years old. And he actually passed away from it when he was 6 years old. It's a pretty rare cancer, childhood cancer. So I spent a lot of my early years in the children's hospital, Ronald McDonald playrooms, that kind of thing. I think watching my parents deal with his illness and his death with so much grace and love, and their faith played a big role in that too. And I think that also had a big impact on me. So I can't talk about wanting to become a doctor without talking about my family, because I think they're some of the people that influence us the most. And this is a picture of my little brother. I just didn't want to exclude him, but he is hoping to become a professional cellist. So a little bit different, but also a very important person in my life. So yeah, this is an interesting slide, but I would say just growing up, the theme that you'll see over and over again is that I like to try a lot of different things. I enjoy activities, especially those that involve teams or being with other people. So growing up, I did tap dancing and I was in the musicals and played softball, was on the Palms team, played violin in the orchestra. And I remember my dad always telling me, like, you can't do everything. Or, he'd say stuff like, you have a lot of like knives, but none of them are sharp, like things like that. And I would respond, but I like it, Dad, and I don't want to quit. I like it. I want to keep doing it. And I think in some ways he was right. Like, you can't do everything, but in other ways, I think I was right in that when opportunities come your way and you enjoy something, to pursue it, and to kind of push yourself out of your comfort zone. I did end up sharpening a couple knives, and this will come into play a little bit later. But I played volleyball in high school, and I also played the piano, and those were kind of like my two main activities in high school. And yeah, I think these are the things that I enjoyed the most, and I was naturally a little bit more just good at. So again, that's kind of a theme here too. But I also enjoyed school, especially AP biology. I was really into science, just kind of all throughout growing up. And I think medicine was already sort of on the radar even early on, but I definitely had an open mind in terms of what I wanted to do. So now we're on to college. I went to Stanford, followed my brother out there. That's another theme of my life. I just kind of follow my brother around. But new place, same story. I think I, had seen my brother go through Stanford. He was biomedical or biomechanical engineer, like 4.0 GPA, had like a zillion research projects going, was just like very accomplished, very driven, like really solid medical school applicant. And I was like, I'm going to do the same thing. And then I kind of got there and I was like, I really like different things. Like, I joined the club volleyball team. I was a freshman RA, which was one of my favorite things that I did during college. I kind of discovered this love for mentoring and building community and planning events and things like that. I was a human biology major, so I served as a student advisor for the major, which kind of, you help people choose classes and find mentors and find summer internships. And that was a job that I just loved. I did dance marathon. I was the community manager for an Italian house. So all that to say, again, there's no like real, I don't know, connecting force through all of those activities. But I guess what I wanted to get across is that I did things that I was kind of naturally drawn to and felt like I also had sort of a natural aptitude for, and just went with it. Like, obviously there were times when I, sat down and I said, I don't know if I'm like the best med school applicant right now. I don't have a lot of like, medically related things. And those things came later on when I kind of more fully decided that I wanted to pursue medicine. But I am so glad that I, didn't let those things hinder me from doing other things that I really loved. And I would say that's really important when you're going into medicine, because it can be a really hard road. So finding things that you love and enjoy and are good at is really important. And I actually, so just as kind of a encouragement, if you ever feel discouraged, I applied to many medical things. I wasn't not doing them for lack of trying. I applied to a couple research opportunities, a couple free clinics, an ED volunteer opportunity. I got rejected from all of them. There are many accomplished people out at Stanford, and I definitely felt very just sort of mediocre. And there are moments when I said, I don't know if I'm cut out for this. I can't even like get a volunteer job at a free clinic. Like, I just was sort of, I don't know, discouraged at that point. That was probably towards that middle end of my sophomore year. But I kind of just started carving out opportunities for myself that I was really excited about. One of those opportunities was getting to go to South Africa, and I did this kind of outside of Stanford. And I got to go to this program where we're in a rural health setting. I got to kind of go around with community health workers, and we would lead these HIV/AIDS education classes. This was like my first exposure to any sort of global health setting. So that was really exciting for me. I loved that. I loved getting to know the people in the community and seeing the relationships that they formed, and just a very different healthcare delivery system there. And then I also ended up pursuing some research. So I I found this pediatric oncologist at Stanford that actually studied neuroblastoma, which was the disease that my older brother had, and got to do some research with her, which was something that I was, yeah, just kind of naturally really excited and passionate about. Um, so I think the things that I ended up doing that were a little bit more kind of classic pre-med things, I still really wanted to be genuine about it. I wanted to be genuinely excited about doing these things, and still got the like exposure and the research experience and all the things that, I needed to go to medical school and make sure that it was the right fit for me. Um, and all this time I was still studying human biology. I was really passionate about that. Um, and I realized kind of through all of these experiences that I really loved serving people in a very direct, face to face way, and learning about people's stories and struggles and being able to help them through science, medicine, research. And so medicine, like again and again, kept coming back as the thing that I thought again that I would like and that I think I would be good at. So again, common theme here: do what you love and figure out what you're good at and passionate about, even if it doesn't always make sense on paper. I think that was big for me to realize. Um, so after college, through working as a student advisor for the human biology department, I found out about this opportunity to be a course associate, which is basically a full-time teaching position where you teach the sophomores that are going through the year-long human biology core curriculum. And so I basically got to teach human biology. I led some sections every week, and I loved this. I had never been like a TA before. I'd never been in a teaching position, and somehow I landed this teaching job. But this was a big like turning point for me. Again, I had not had any teaching experience, but again, I felt like, that sort of mentorship relationship I had experience with, and I had done well in the human biology classes, and I kind of put two and two together and was like, I think I would enjoy this. I think I would like be pretty good at this. And I would learn so much just being able to communicate about a lot of these concepts and things that we're learning. And I thought it'd be pretty good preparation for medical school, just brushing up on a little biology. Um, but this was an amazing year. I really discovered a passion for teaching and mentoring that I would bring with me into medical school. So I had a little bit of a harder time applying to medical school, especially harder than my brother had made it seem. But I ended up getting into Vanderbilt, and at first, I was actually I had wanted to initially stay in California because that's where my partner was, and he was still going to be there, and or go home to Chicago. And Vanderbilt, had obviously been on my radar since my brother had gone there, but I didn't realize at the time how perfect a fit Vanderbilt would really be for me. Kind of fast-paced curriculum. They are like at the forefront of innovative teaching and learning strategies. And they also really prioritize wellness and community. And so all of those things made it a really good fit for me, actually. And I'm so glad I ended up here. But so this is me at my white coat ceremony, anchor down, and just kind of a fun personal tidbit, but that is my now husband, who also ended up coming to Vanderbilt the year after. So we are just so thankful that we ended up here and it really all worked out the way it was supposed to. Um, but yeah, so sensing a theme here. I'm trying to build on my theme, but here at medical school, I think I also didn't do kind of the typical medical school things, but I think I started to gain confidence in the things that I'm kind of, really enjoyed, naturally good at, which were mentoring, community building, event planning, and then some of my other interests like research and global health. And I started to become more confident that those are the things I wanted to pursue, and I wasn't going to be kind of like, ashamed that I wasn't doing maybe what I thought I was supposed to be doing. So I got really involved in the college system. That at the bottom left, I'm in Robinson College, which I got involved as like a student mentor in the college there. Played intramural volleyball, still playing volleyball. We were called the Beta Blockers, great team. I was involved in like the cadaver ball. It's like our med school prom, and we make funny videos. That's the picture on the top left. We did a little dance number, and then kind of more academic side, I got to go to Kenya and do a global health rotation at Luwala there. So again, I think I just really felt more confident this time around, just like diving into the things that I just thought were really cool. I was like, I really want to do that. I think that would be fun. And I didn't let that, I don't know, sort of the expectations stop me. Um, kind of transitioning more into professional life here. I came in thinking that I wanted to do pediatric hematology and oncology, so cancer in children, because that's what I had done my research in. I had had the most exposure to that. But kind of throughout medical school, I realized that I just really loved anatomy. That was like one of my favorite parts of first year. I loved, I rotated a little bit on ENT because a few people told me they thought I would enjoy it. And ENT's ear, nose, and throat, by the way, just in case anyone doesn't know. But I realized that I love the people, the patients. I loved surgery. And I think kind of as a former like setter in volleyball, a former pianist, like I really enjoy learning new skills with my hands, and I just hadn't really like put that together as like that could be a part of my career. But I think this is a picture of me in one of my like first ENT head and neck surgeries with Dr. Netterville, who's like a world renowned head and neck surgeon on the right. And that just like it just made me so excited. And again, I think I had to sort of change my expectations for myself and go with sort of my gut feeling of like, I think that I will really enjoy this, and I think that I would be good at this. Like, I think I have some natural qualities that I could train and, grow in that would make me a really, hopefully good ENT surgeon someday. So I have just finished my year out. I kind of, due to some personal circumstances, my husband had come a year after me. And so I talked to our dean, and she had suggested that I do a year out so that we could line up and couples match. But I was like, I don't know. I never thought about doing another degree. I always thought I would just go straight through medical school. I had some research projects going, but maybe not enough to do a whole year. And so I ended up doing both kind of research and another degree, even though I hadn't been planning on it. So I participated in the Medical Scholars Program, which I did some work in pediatric ear, nose, and throat research, which I'd be happy to talk to you more about. I'm not going to focus on that here, but work with Dr. Phillips, who does cleft palate surgeries, and looking at speech outcomes for them and how they can utilize kind of state social services and ancillary services to help them attain better speech and just quality of life outcomes. So I did that and was really excited about that. I was like, I'm so excited to go to clinic and see these patients. And then I also, at the recommendation of our dean, decided to pursue a master's in health professions education. And this is an online master's program through MGH, which is Massachusetts General Hospital in Boston. And they have this Institute of Health Professions. I'd never heard about any of this. I had never considered pursuing a degree in education. But I think when she told me about it and I looked more into it, that just made so much sense to me. And it's been a really awesome program. And so that's kind of what I'm going to focus on here at the end of my presentation is I feel like I found my happy place in medical education, and have gotten to participate in 2 medical education opportunities here at Vanderbilt and have sort of built on those experiences through my master's coursework, have gotten to kind of like refine these experiences, curricula, etc., with my master's coursework, which has been really wonderful. Students as teachers, I got involved during the end of my second year, but it's basically a class for rising fourth year medical students who want to learn kind of about the theories behind teaching and learning, and also gain practical skills so that they can become better clinical teachers when they're in residency and future attending physicians. So we would work on giving a short chalk talk, or how to give a PowerPoint presentation, how to do a clinical encounter with a student and help them become better at their history and physical exam skills, things like that. And I got to kind of be in the side of the teacher learner. That doesn't make sense, but where I got to practice all these new skills and learn from the class. And then I also got to direct the course. And so kind of choosing what we would be teaching our rising fourth year students and arranging those experiences and course sessions for them. So that was a really awesome experience, just to get to, it's like, it was a little meta. It was like teaching about teaching, and I was learning about teaching at my master's and got to do a lot of kind of application projects with that class. And then another class that I got to be a part of was called the Practical Skills Elective, which I helped direct this past year. But we would do these short 2-week courses with our clerkship level students to help them become more comfortable with practical skills that we actually don't get a whole lot of practice with, like starting an intravenous line, which you would hope that a doctor could do by the time you graduate, but you'd be surprised how many people haven't placed an IV line. Things like intubating or suturing, just lots of different practical skills, and again got to apply a lot of the theories and concepts of curricula building and learning objectives and things like that from my master's while I was directing this course, which was really awesome. And then I also got that sort of face-to-face mentorship teaching experience that I also really enjoy. And I think I just realized that these were the things that I didn't get tired of doing, that I was excited to prepare for, I was excited to be at, that really energized me. So I think it was just important for me to kind of have that experience and know that that's something that I really want to incorporate in my career. So yeah, I would say my big takeaway points, I know I'm maybe a little bit, this was only supposed to be 20 minutes, but I'll wrap up. But I would say play to your strengths and do what you love, even if it doesn't make sense on your resume. It will come together. And find ways to translate your interests and passions into career goals. I think for me, my kind of dream job right now would be to maybe be in charge of like ENT resident education, and or be a medical student course director or mentor, while still doing direct patient care and also participating in clinical and maybe even educational research. I know that sounds like a lot, but I've seen people do it, and I really think it just combines so many of my passions and interests. So and I didn't think this is where I was going to end up if you had asked me. So just kind of went with it. And I guess my final point is to enjoy the journey. And that kind of ties it all together. I think people told me this would be a really hard road, and in a lot of ways it has been, but I have absolutely loved it. And I think it's because I did things that I loved and developed skills that I enjoyed doing. So, yeah, that's a little bit about me. I'd be happy to answer any questions.
Hannah, thank you so much. That was just really wonderful. I think one of the things that we're going to hear a lot about, we're going to have a talk on admissions, is the importance of not check marking boxes when thinking about applying to grad school, but actually doing exactly what you said, finding the things that you gravitate towards and building on those strengths. And even just life lesson, do what you love. And oh, I need to hear that all the time. It's okay if you don't know what it's going to lead to. That is just okay. So thank you, Hannah. I think we have time for one, maybe two questions. So if anybody wants to put one in the chat or if you want to unmute. Preston, I see your hand up, and then Vilma.
Hi, Hannah. It seems like medicine's like a big part of your family, but what advice would you give to those of us that don't have any doctors or like even healthcare professionals in our families at all? Maybe we're like the first one in our family to do that.
Yeah, absolutely. I think that was kind of a huge privilege that I had to sort of be in that world already. But I would say um, to find opportunities to kind of immerse yourself in that world a little bit more since you won't be as familiar with it. So those are things like, shadowing or being in a clinic, just kind of figuring out what this whole doctor thing is about, what it's like to be in a hospital, what it's like to be in a clinic. And I think those are things that look good on an application, but more so for you to like make sure this is something you really want to do. I think it can be a lot different than what people expect. So yeah, that would be my advice.
I have
Thank
a
you.
quick follow-up. Preston, excellent question. Thank you. Hannah, just out of your gut feeling, what percentage of, would you say, your class had family with medical, experience? Was that a high percentage or low?
I would say it's maybe about, I don't know, 50-50. I think there are people that kind of come from like really long lineages of doctors, and that's like they came out of the womb knowing they wanted to be a doctor. And then there's some people that are like, you know, this is totally out of left field, or, we have a lot of first generation students who um, they might have been first generation to go to college even. So to pursue a graduate degree was also, yeah, kind of didn't wasn't what their family had done necessarily. So we've got a good mix.
Thank you. All
Mm-hmm.
right, Vilma, go for it.
Hi, thank you so much for sharing all of that, Hannah. That was really inspiring to listen to you. I was wondering if you could talk a little bit about your experience with imposter syndrome, if you ever did experience it. It seems that you have been raised in very like competitive environments, and so I was just kind of curious about that. And if you have any advice.
Yes. We talk about imposter syndrome a lot at medical school because I think almost everyone deals with it. I think the moment I stepped foot at Stanford, I was like, whoa, I don't think I'm supposed to be here. And I think same thing here at Vanderbilt. I think a couple things. I think really embracing, like I said, your passions and your interests, like your specific passions and interests, will help you with that, and not trying to be like everyone else, because that means you really are an imposter. Just like doing your best to be like your best self. And for me, that was like embracing teaching and mentoring and stuff like that. I didn't necessarily like publish 15 articles, and sometimes I'm like, wow, I wish I were better at research, and I'm working on that. But I think those are the times when I really feel a lot of imposter syndrome, is when I'm like grasping at things that, are really good to learn and do, but maybe don't come as naturally to me. So I think really leading into the things that you are good at and passionate about will help. And I think another thing is finding a really like solid community of people that you can talk to about. And nothing helps imposter syndrome like sitting with like 10 other med students who also have imposter syndrome, and you're kind of like, well, I guess it's okay then. Like, I guess if we're all feeling it, like, it's fine. And I think you sort of start to realize that everyone's feeling it a little bit. Like, you can only do your best, like you can only just try as hard as you can, and you're here for a reason, and you have very unique, you know, attributes and things that you bring to the table. And I think you'll grow into that as you go.
Thank you.
Awesome. Thank you so much, Hannah. I really just
Word.
appreciate your talk. And just for time's sake, we're gonna have another speaker here. Oh, I see Hannah dropped her email. Thank you, Hannah.
Yes, no problem. And I'm truly happy. If you didn't know, I love mentoring and talking with younger students. So if you have any questions about anything at all, med school, whatever, happy to answer them.
Perfect. Appreciate that so much. It's clear you care about this.
Check out our website to find recordings of all of our videos. We'll get them posted about a week after each of the presentations. We can't wait to see you!